These are the pathology flashcards for module number 4. These pathologies are a little bit unique than the ones that we've seen before because these pathologies oftentimes have an effect on physical therapy instead of physical therapy directly impacting the pathology. Instead, we have to be aware of how it's going to change our physical therapy interventions instead of the other way around. So with each pathology, the questions are going to be at the top of the slide and then the physical therapy intervention at the bottom. So you can pause the slide as soon as we get to it to write down your information and then restart the recording. Our first pathology is bulimia. With bulimia, we know that these patients are often in a binge purge cycle where they're throwing up over the course of a significant length of time, but we're not seeing necessarily a change in their physical appearance or their body type. Because of that, these patients could often go into an excessive exercise routine as well. So it's important that we focus with them on stretching, gentle weight bearing, gentle strengthening exercises. Something like yoga or Pilates might be ideal for these patients, maybe some Tai Chi, because these patients may have negative exercise behaviors where they're doing aggressive exercise. That's going to be harmful. Because of throwing up too, we want to be cautious because they could have some electrolyte imbalances, so we need to monitor their vital signs. With Wilson's disease. Wilson's disease mimics Parkinson's disease, which we'll see in the next module. Parkinson's disease is characterized by bradykinesia or slower movements. These patients are going to be more at risk for falls, could have fatigue, so we want to monitor their fatigue and just be aware. Sorry, I had a little blip there. One of the things that we need to be aware of with Wilson's disease is that they may have an affect disorder, which means that their facial expressions may not match their actual emotions or feelings, or they may not be able to actually demonstrate those emotions or feelings very easily. So just being aware, when someone is excited to see you, they smile, but these patients may not. Addison's disease. So go ahead and pause here for your questions. With Addison's disease, low-grade exercise for fatigue minimize the stress overall because Addison's affects all of the cortisol that the patient is having or that the patient has in their system. So we want to monitor their vital signs, watch for electrolyte imbalances, any decreases in blood pressure because of inappropriate levels of electrolytes, and then no aquatic exercise. That is very unique for Addison's disease, is no aquatic exercise. Because of the heat of the pool increases the amount of cortisol, which we don't want anyways. So everything to reduce cortisol. Cushing syndrome. Cushing syndrome impacts physical therapy because it impairs a patient's healing, has a negative impact overall on the cardiovascular system, and we'll see that muscle tone will be affected for these patients, and therefore they may have a generalized decrease in muscle strength. We need to work on what's called proximal stability, so we need to make sure that our biggest muscles are strong so that we have enough mobility to do all the things that we need. Proximal stability gives us distal mobility, which means our shoulders need to be strong in order for our hands to function well, our hips need to be strong, and our core needs to be strong in order for us to be able to have balance and strength in our feet and our knees. So a lot of good basic strengthening exercises and core strengthening. So here is a picture of a patient with Cushing's pre and post. So you can see the classic sign of Cushing syndrome is that moon face. Psoriasis and Rosacea. So go ahead and write down your questions. Psoriasis is treated in physical therapy with ultraviolet, which you'll learn in PTA 202. And they use medication during the utilization of UV. Sorlian is what it's called. So this is PUVA, P-U-V-A. Also, there is psoriatic arthritis associated with psoriasis, as not everyone who has psoriasis will have the arthritis component, but if they do have arthritis, we are going to treat them with range of motion, basic exercise, and then arthritic patients have an increase in pain, so therefore we're going to do pain management. That is it for module number 4.